The Muriel McQueen Fergusson Centre for Family Violence Research acknowledges that it carries out its work on the traditional unceded territory of the Wolastoqey, Mi'kmaq, and Pescademocati peoples. This territory is covered by the Treaties of Peace and Friendship, which these nations first signed with the British Crown in 1726. The treaties did not deal with the surrender of lands and resources, but in fact recognized Mi'kmaq and Wolastoqey title and established the rules for what was to be an ongoing relationship between nations. We pay respect to the elders, past and present, and descendants of this land. We honor the knowledge keepers and seek their guidance as we strive to develop closer relationships with the Indigenous people of New Brunswick.
Welcome to In Conversation, a podcast produced and hosted by the Muriel McQueen Fergusson Centre for Family Violence Research at the University of New Brunswick in Fredericton, Canada. At the MMFC, we're dedicated to advancing knowledge, fostering dialogue, and creating change through community-based participatory research on family and gender-based violence. Through this podcast, we bring you insightful discussions with researchers, advocates, policymakers, and community members who are working to address the complex issues surrounding family and gender-based violence. My name is Denis Gagnon. I'm the Associate Director of the MMFC, and I'll be hosting and moderating today's episode. In this inaugural episode, we welcome Katie Hamill, PhD student in the Faculty of Education at UNB. We'll be discussing the report on the ongoing impact of COVID-19 and on the domestic and intimate partner violence sector in New Brunswick, Canada. Welcome, Katie.
Hi.
Thanks for joining us today.
Thanks for having me.
So today we'll be discussing this report on that you've written in collaboration with Dr. Cathy Holtmann.
Mm-hmm. Yeah.
That I've had a lot of questions about, or I guess I've been asking you about this for a while, and I've been curious, and so I thought it would be a great opportunity for us to host a podcast around it.
Cool.
Yeah. So tell me a little bit about the project, how it started, your role in it, and who was involved.
Sure. Yeah. So for me personally, this was my introduction to the MMFC, and I had really just applied for a job as a research assistant, and then our relationship has grown from there, which has been great, and I've gotten to do a lot of really cool work that's been really meaningful to me. So I was the research assistant on this project. This was a project that, similar to a lot that happened at this particular research center, someone had come to you asking for some research to be done. Mm-hmm. So research that was funded by the federal government through Women's Shelter Canada and the Women and Gender Equality Canada. Mm-hmm. So this project specifically looked at how COVID-19 had impacted transition homes and second stage housing and domestic violence outreach in New Brunswick during COVID-19. So that meant at the very beginning, like what was taking place during March 2020. Mm-hmm. And this report came out in December 2023. So there was a little bit of space after that of once lockdown restrictions were lifted, what was continuing to happen in these spaces and for women experiencing violence in New Brunswick.
And so this project also involved the Domestic Violence Association of New Brunswick and the Réseau des services pour victimes de violence du Nouveau-Brunswick, which are the two overarching organizations that support transition houses and second stage housing in New Brunswick.
That's right.
And so tell me a little bit about what was the objectives of the project? What were you looking to find? And what did they come to us wanting to find out?
Right, yeah. So I think, I think there was kind of a number of objectives. It first started with sort of getting a better understanding or a broader understanding of what was actually taking place in transition and second stage housing during isolation and lockdown. What did that actually look like? And what were the broader community impacts of that? So that's a number of things in terms of, what does it look like to run a communal living space when you're in isolation? What does that look like for staff? What does that look like for folks living there? And what does that look like for folks trying to access those spaces that are operating in a different capacity than they typically do? So there's the initial, okay, how do we do this? Like once public health policies were in place, how do you respond? And then what are the ongoing responses that have to take place? which is everything from literally how do we clean the kitchen to how do we fundraise to how do we support women who are currently isolating with an abusive partner. So it was really broad, and there was a lot of different parts to kind of the bigger story.
Can you tell me about the approach that you took to collecting the data and analyzing it?
Yeah, so this was mixed methods. So we did a number of things: surveys, interviews, and focus groups. And these were all either with staff or executive directors of second stage houses or transition homes in New Brunswick, and a few domestic violence outreach workers as well. Some of those people might have a variety of roles, so they're doing domestic violence outreach, but they're working through a transition home. So speaking primarily with staff, offering surveys, offering interviews. Some of the participants did both, and then also offering a focus group as well. The focus group we attached on to a larger meeting that was already taking place with all of the executive directors of second stage houses in New Brunswick. They did their regular meeting in the morning, and then I kind of joined in the afternoon, and we had a larger conversation. So all of those conversations, whether it was a focus group or an interview, were then transcribed. Myself and Cathy Holtmann took a look at them all, found the general themes, kind of coded it all, and to see what folks were saying and what appeared across the board.
When you were finished collecting the data, was there anything that jumped out at you, like in terms of when we're doing, especially like the qualitative data collection, we're looking at themes, we're looking at, can you tell me about some of the underlying themes of the data that you collected?
Yeah. One thing that was interesting about this project, I think any research that you do, although you're not going in knowing the end result, you sort of have an idea of what you think might come out of it. So I really thought going into, especially the interviews and the focus groups, that what participants would want to talk about was what it actually looked like to run these spaces when isolation mandates were in place. One thing that was interesting is the research took place, I believe it was summer 2021 that I was doing the research, maybe and then fall 2021. And time during that period of our lives was so peculiar, and folks even, everything was moving so quickly, and they were adapting to all the different changes and the ongoing impacts, that even asking people to think back to, how did you share a bathroom space? How did you share communal kitchen spaces? For them, they were thinking about the future at that point as well. So they were even reflecting back and, kind of had to try to remember of what had taken place during those first few months of isolation that were so chaotic, and everyone was, doing their best to do the right thing. But they were thinking a lot about the future at that point. And I had thought going into it all that would really be what we talked about, was what was taking place during the actual isolation.
Yeah.
But what I found to be really interesting is how much people were looking to the future and looking at the complexity of cases that were coming forward to them at that time. They're seeing, a dramatic increase in the complexity of violence that was taking place, the severity of violence that was taking place. And although lockdown and isolation might have been lifted, those restrictions might have been lifted, the complexity and the severity of violence continues to be on the rise. And folks also talked a lot about the funding they were able to receive during isolation. So towards the very beginning of the pandemic, there was a lot of talk, even in the news. The World Health Organization, the Canadian federal government was talking a lot about this secret shadow pandemic of an increase in domestic violence, of what it means when you're literally trapped in a place with your abusive partner, and what it means when risk factors for violence are exacerbated through psychological stress of a pandemic, through financial stress of a pandemic. All of these different things that all of us were experiencing led to an increase in the frequency and the severity of violence that was taking place. And as a result, the federal government was able to give out a bunch of money that hadn't existed before. The money was intended to offset additional costs that the pandemic might have, caused, such as like PPE, cleaning supplies, all of these various things. But what it really did was allowed transition homes and second stage houses to expand their service model in a way that they weren't able to operate previously. So they were able to not only purchase things that they needed in order to, offset maybe some impacts of the pandemic in terms of cleanliness, etc., but it also meant they were able to support women in new ways that they just weren't able to before.
And what were those new ways, or I guess the new was it new interventions? Were they new services and programs? What did that look like in terms of the new ways they were able to help women?
Yeah, so transition homes and second stage houses in New Brunswick are not-for-profits. They run primarily off of fundraising. So there's a very finite amount of money, and that amount of money might change from year to year depending on how they're able to fundraise. Another thing, during isolation, fundraising was quite high. People were giving quite a bit of money because they were, taking in the news and they were aware of the violence that was happening. So there was just new money coming in, and that allowed for an expansion of the service model in terms of renovations that had needed to take place for a decade that couldn't have taken place before. Even in terms of providing women living in transition and second stage houses with things that they couldn't before that might help them on their journey of healing and on their next stage of life of wherever they're going from here, including things like grocery store gift cards, NB Power gift cards, paying the damage deposit on a first month's rent so that they're able to move out of a transition home into an apartment. All of these other financial factors that might impact someone in the way that they're able to leave their abusive partner, in the way that they're able to stay away from their abusive partner once they have left and not return. A number of things that they were able to support them with in order to heal.
And so in, writing this report and presenting it back to the Domestic Violence Association in New Brunswick and the Réseau des Services, presenting that report back to these two associations who contracted you and Dr. Holtmann to do this research, what was your, what was the outcome, or what was it that you gave to them in terms of like recommendations from this research?
Yeah, I guess one of the major recommendations was some of the infrastructure that was able to come out of COVID-19 in terms of moving services online. That infrastructure really didn't exist before, and there is a number of concerns over safety in delivering some of those programs. For example, if someone is living with an abusive partner, they might not be able to participate in an online program out of fear that their partner might know. And that was an ongoing issue. During COVID-19, a lot of service providers told me that they would receive phone calls that would end abruptly if a partner walked into a room or if a partner had gone to a store and returned home. And there was some concerns over how to deliver support virtually, whether that's over the phone or over a video call or whatever. Also, in March 2020, when lockdown occurred, they didn't have these online things established already. Even in terms of tech that employees at transition homes might have, they didn't have laptops that they could take home with them. They didn't have phones. There's concerns over safety of like clients' files and the confidentiality and taking those out of your office to bring them home or having them on a laptop that other people might use. Like the infrastructure just wasn't there. So the emergency funding was able to help establish that infrastructure. And one thing that I heard a lot from participants was just, a commitment to keeping that going.
Yeah.
One, in case another pandemic were to occur, and two, it's kind of the direction that the world is moving in. And you're also able to offer services to a wide variety of folks if you can reach them online versus asking them to travel, into downtown Fredericton to go to Liberty Lane.
Right.
So one recommendation was to just sort of keep that moving forward.
The funding, you mean?
The funding, and And the funding is one thing, and the other part is like the figuring out of how do we do this in a safe way.
Right.
How do we deliver these programs? What kind of programs can we deliver online? What does that look like? How do those happen? Yeah, just like I think that those conversations weren't really happening before, and now that they are happening, there seems to be an interest in like how do we keep those going.
So was the funding all completely expired, or did it all completely stop after a certain point?
Yeah, my understanding is that it was like towards the end of 2020 and then into 2023.
Okay.
There was two big chunks of money basically that went out.
Okay. Well, and it falls into, like we've seen a lot of post-pandemic, but post-restrictions, which I think is the better way to put it. We've seen things like the National Action Plan on gender-based violence, which has been, I think, in some ways positioned as kind of the alternative or the new funding streams. And so it's interesting to see, sometimes you think it's just the funding might be just a short-term relief.
Yeah.
But it really creates opportunities, and especially for organizations that are so crippled by lack of funding, it opens up all these doors where you want to be able to kind of continue that support, right?
Yeah. And I think that the funding itself was presented as emergency relief.
Right.
But from the perspective of people, frontline workers doing this work, that the emergency is not over. The emergency is continuing.
Yeah.
And as we move, further and further from the initial March 2020 isolation, the cost of housing has increased. We've seen all of these other factors that make it increasingly harder for someone to leave their abusive partner. And we see an exacerbation of risk factors that hasn't ended because restrictions have ended. It's just continued. And the psychological stress that COVID-19 kind of sparked has continued, and the substance misuse and abuse that has come from COVID-19 has continued as well. Yeah. And financial strain is one of the biggest risk factors for domestic violence, and the financial strain has continued.
So I've read the report on a few occasions, especially in preparation for this conversation, and there were some fantastic quotes in here in terms of, just expressing what was going on.
Yeah.
So I don't know if you can share some of those with us and how they related to the themes that were brought out.
Yeah, a lot of folks talked about their transition to working from home and how suddenly that happened for them as well. So for people that were actually working with folks, whether it was through domestic violence outreach, depending on their situation, they then also were working from home. So there's a number of challenges for them as well. Like everyone, they were then stuck at home trying to parent and work, and they didn't have the technology infrastructure, so they didn't have laptops to work from home, they didn't have cell phones to work from home, so there was a little bit of a gap between the service delivery where they had to wait for those things to sort of come in, and like everyone kind of get used to the life of isolation and what that all meant for them. So there was challenges across the board for individuals in terms of being able to deliver services. Within that too, it's not a service that's typically done virtually. And we've seen that with other things, whether it's counseling or therapy or whatever else. So there was also a bit of a learning curve to delivering counseling and domestic violence outreach online and sort of what that looks like. So one of the quotes that I have is, "We didn't have laptops, we didn't have cell phones, so we had to purchase all those. And when you try to work from home, you're so isolated now, you didn't have access to printing your files, so you have to take all your confidential files home with you." And then there was a lot of concerns about safety as well. So one participant said, "It's not the same if you're not meeting in person, because you're just meeting with someone over the phone or on Zoom, you don't know who else is there." And another said, "You don't know if people are listening, and it's not like you're in a controlled environment."
Yeah.
So a lot of fear that the abusive partner is then aware that someone is seeking services, and fear that that would then lead to an increase in violence as well. But yeah, one thing that was interesting too about moving more online or finding online ways to do things is some of the participants noted that they were able to move fundraising techniques online as well.
Yeah.
That they weren't necessarily doing previously.
Yeah.
And they were exploring social media options and ways to engage in fundraising in different ways. A lot of these organizations are so strained in terms of employees. There's, not very many people. There's not very much money to go around.
No.
So one thing that this emergency relief funding was able to do was to allow them to hire new people or expand wages so that someone could then take on, how do you figure out fundraising online?
Yeah.
Or how do you figure out developing online programs?
Yeah.
Whereas before, everyone's capacity is just so limited, and you're often dealing with folks in crisis that then, finding social media fundraising techniques doesn't seem...
It's not necessarily
It's not at the top of the list, when people are, literally showing up in crisis. But this allowed an opportunity to kind of explore those avenues.
Yeah. So tell me a little bit more about what service providers had to say about the expansion of programs that was possible through this additional funding.
Yeah, so I have a number of things, a number of great quotes. One is, we employed extra staff, we added extra program like the kids program, we bought cell phones, we bought laptops. Without the federal funding, there wouldn't have been any of that. We wouldn't have been able to work remotely. Someone else said, I found that the money that we received allowed us to expand our service delivery, allowed us to offer more programming and meet the needs that we had been struggling to meet before. Being able to offer virtual appointments, being able to help clients access those during the pandemic, and supplying them with electronics to be able to continue to access those services, which many are now. So I found it changed and helped us evolve and adapt our service delivery in a way that we wouldn't have been able to do it before. And to be able to offer more services, more comprehensive services for both women and children.
And when you look at those, it's really basic needs. I think that for someone who is not necessarily familiar with the sector or the services that are offered through a transition home, I think would be surprised to know that, wow, they don't even have cell phones. The workers don't have cell phones. They don't have laptops, or they didn't prior to the pandemic. So it's really eye-opening, even for myself, who is aware and familiar with this sector. Just how little they had and little they have, and that the amount of work that they're able to do with what they have.
Yeah. And I guess that was sort of because when I had become the research assistant on this project, I was a researcher. I was into my PhD, but I hadn't really done research in this specific sector before. And that was the part, I think, that sort of shocked me the most, I guess. I'm not sure what the other word is.
Yeah.
Because I really thought that talking to participants in this research study, they would be telling me about what it was like to have to make a schedule to clean the bathroom and use the kitchen, which they totally did.
Sure.
But all of that they were able to handle. And some even reflected that it created a really unique bonding in the transition homes at that time, that they were sort of all in it together. One of them told me that once PPE restrictions were lifted, that all of the staff did a fashion show for everyone living there, and they took off their PPE and they strutted up and down the hall, and they just had this kind of beautiful moment within these horrific circumstances. And I didn't realize that the thing that people would mention the most was we were able to buy groceries. Yeah. And how much of a difference that makes in someone's life when you've left an abusive partner, when you're in a transition home, when you're in this moment of huge transition in your life, and the support that it means to have someone cover a damage deposit so you can have a place to live. Extremely basic things. That I didn't know that the sector wasn't able to already provide. I don't think I had a full realization that these organizations are truly not-for-profit. They're so crucial for well-being of a lot of people. Yeah. And 1 in 10 women in Canada experience gender-based violence, and I didn't know that they were not-for-profit. Yeah. So that was the part that really, I think, stuck with me the most. And the part that I think the most about is like buying groceries for people. Like these really basic things.
So all really interesting things, Katie. You know, and like I mentioned earlier, you've been working with us on different projects, and I foresee that you might be in other episodes of this podcast coming up. So this is not a goodbye, but a talk to you later.
Yeah.
So thanks for taking the time. Do you have any
no problem.
closing remarks or anything that you wanted to add to this discussion?
Yeah, I don't know. I think, you know, one thing that really stuck with me throughout this entire project as well and beyond was I struggle with the word resilience.
Yeah.
But I'm not sure what the word is I'm looking for, and I'm not even really sure if the word exists. But the ways in which people within these transition and second stage houses were able to adapt to make it work, to meet with clients and support their needs when a lot of the time, you know, oftentimes what people need is a hug or they need some comfort, and they figured out ways to make it work. People talk to me about having, you know, counseling sessions where one person was in the hall and they had the door open and they were in their office, so they were still making eye contact, but they were within social distancing.
Oh, wow.
They were meeting the regulations. And it was really, you know, quite beautiful how it all took place. Sort of within obviously a very horrific circumstance and people that are undergoing really horrific things. But then there's these little pockets of like really beautiful human connection that was coming out of it too.
Well, thanks for your reflections, Katie. I think that this is great. I hope that you know, this conversation brings you know, light to other people who are interested in learning about you know, transition homes in New Brunswick and in the Maritimes in Canada, and better understanding the impact of COVID-19 on services and interventions for intimate partner violence. So thank you, Katie.
Thank you.
So thank you to Katie, our guest today, as well as our listeners for listening to our inaugural episode of In Conversation. If you wish to have more information about this report and other projects of the MMFC, you can visit our website that will be on the screen. And if you wish to donate to the projects of the MMFC or to our operations, you can do so through the Fergusson Foundation, and their website is on the screen as well. So thank you very much, and see you next time in Conversation.